Hello, I am Dr. Dinesh Sharma. Today we will discuss something about retinitis pigmentosa. Retinitis pigmentosa, it is a genetic disease which is commonly also called as RP by its short form, and in Hindi, in India, in local language we say it Ratondhi. So basically it is a genetic disease which runs in families. Generally it is seen that it runs in families from one generation to another generation, but not compulsory every time. In many of the cases we have seen that this disease appears in one particular generation and it automatically ends with the same generation and does not proceed to the next generation. So there is a genetic mutation inside the genes at the time of pregnancy. We can say that some mutation happens, some error comes in the genetic material, genetic combination of the child, and it is like a computerized virus program which gradually damages this retina of eye. There are pigments in the retina, they are formed, and this disease starts to show its effect sometimes in the age of 5 years or 10 years, and patient loses complete vision at the end of 20 years or say 25 years. In many of the cases it is also seen that it starts its effect in the age of 20-22 years. And patient gradually loses vision till the age of 60 years. Or we can say that even in some cases, at the age of 60 years, patient restores some of the vision. And it is natural. We cannot say in which patient the progress of the disease will be fast and in which patient the progress of the disease will be slow. There are multiple varieties, clinical types of this retinitis pigmentosa. Sometimes it is syndromic, associated with some other body functions. In some of the cases it is also attached with this mental retardation. Polydactyly, there are 6 fingers in the hands, and in some of the cases it is also associated with hearing loss. There are many clinical presentations of this disease. So the ground factor is that it is a genetic disease and there is a genetic mutation in the genes, and it appears in its own speed. We cannot identify at which speed. This is the most important point. Many patients, they ask us in our practice that what is the prognosis in future, for how much time we can see this world. So it is not able to, it depends on the individual's body nature. It cannot be identified previously. So the symptoms of this disease the basic symptom of this disease starts with night blindness. Patient starts to feel that he has some difficulty to see in night time, when the light is less. Or the second symptom starts peripheral loss of vision. Every human being has a normal field of vision. We can by seeing straight, I can see this side, this side, this side, and this side. 360 degree, there is a field vision normally. So what this disease affects, how this disease affects, it reduces the field of vision. So if a patient is driving, he will not be able to see who is overtaking the car. If a patient is getting down from the stairs, he will not be able to count how many stairs are pending. So this is the second symptom that a patient feels that he is not able to identify in his peripheries. Floaters, patient sees some black floaters inside his field of vision, and he sees sometimes this flashes of lights, some stars are glowing, and these are a couple of symptoms that this patient of RP presents in our clinical practice. We see that by these symptoms patient come to us. So it is a disease of rod cells basically. In our retina there are 2 types of cells. One is rod cells, another is cone cells. Rod cells are responsible for night vision and peripheral vision. Cone cells are responsible for day vision and color vision, bright vision. This is a disease of rod cells basically, but when there is an abnormality in the periphery, the cone cells cannot remain themselves healthy, and with passage of time, patient also starts to feel problems in his day vision, distance vision, central vision. And ultimately blindness is the only result. There are many research going on this particular disease in modern science, but till today there is no successful remedy in any system of medicine which can cure this disease. In Ayurveda, with our experience and with the time-tested medicines of Ayurveda, we have found that if this disease is diagnosed timely and patient comes to our clinic in the very initial stages of disease, it is possible to slow down the progress of damage. In some of the cases we have also seen that progress is completely arrested at least for a particular duration of time. If the patient is a child, if the patient is a young one, then we can say with confidence then it is really possible to arrest the regeneration process at least for a particular, for the active life, for the minimum time duration, we can arrest the damage process so that the damage, so that the present vision status will be maintained. There are some cases who responded with the treatment also. They showed some positive signs also. Some of the patients who had very problems with the light, they felt comfortable with the treatment. They can now go in the sunlight, they can face the sunlight with more confidence. Some of the patients also responded for the peripheral vision, for the night vision. Floaters reduced, so the patient is able to utilize the available vision because of floaters and flashes. Sometimes patient is not even able to utilize whatever vision is remained in the retina. So some of the patients also responded positively with this treatment. But as I said that the effect of genetic expression cannot be nullified, so it becomes important to continue with the treatment throughout the life. And it is like a mobile battery charging. Once we charge the battery, we can use it for a specified time duration. Again we have to recharge it. But the beautiful and pleasant point of Ayurvedic treatment is that it is free from every type of side effect. There are no complications associated with the treatment, no risk factors and no surgeries involved. We just need to understand the nature of this treatment. Whatever vision is remained in the eyes, we have to put a pressure with the treatment against the genetic expression of disease. And as I told you that in many of the cases, we could make it possible. This is a complete purification and rejuvenation treatment, which includes approximately 3 to 4 weeks in some of the patients. And the standard protocol is for 3 to 4 weeks, I need to say. It includes internal oleation, external oleation, sedation, steam bath, then purgation, cleaning of the bowels aggressively, and afterwards starts the rejuvenation treatment like Shirodhara, Tarpan, and oral medicines also are associated with that. And these all are natural procedures and free from any type of side effect. There are no complications associated with these treatments. And of course, the oral medicines that we need to use in this particular disease, they are specified as per the condition of the patient. They are chosen after a personal consultation. But I have mentioned in my previous lectures also, that every body is a unique body made by nature, Vata, Pitta and Kapha. We first assess the prakriti of this patient, then the vikriti of this patient, pathology I mean to say of patient, at what level the disease has come, and what best can be done in that particular condition. So it is a specified treatment, it is not a generalized treatment. Patient has to contact our hospital for this treatment, and I can assure you, we do not claim 100% success for this disease, but we are satisfied that thousands of patients, they find solace in the scientific heritage of Ayurveda through this institute, through Prakash Mitralaya. And as far as RP and another genetic diseases of eyes are concerned, I am proud to say that we are able to give very good results. Thank you.